Welcome, everyone, and thank you for joining us for today's webinar, From Devices to AI, the Evolution of Healthcare Technology with Zebra. In partnership with Zebra Technologies, we're diving into the innovations shaping the future of healthcare technology, from advancing devices to the transformative role of AI. We'll explore how these tools are improving workflows, reducing costs, and enhancing care for healthcare professionals and patients alike. I'm thrilled to introduce our guest speaker, Kassaundra McKnight-Young, the Chief Nursing Informatics Officer at Zebra Technologies. With 29 years of healthcare experience, Kassaundra is a leader in bridging healthcare technology and to improve the patient experience and operational efficiency. Her expertise spans workflow optimization, bedside care innovation, and empowering staff through technology integration. Let's get started as we explore technology in revolutionizing healthcare. Hello, Kassaundra.
Hello, how are you?
I'm doing great.
Yeah.
It's been some time since we last connected, but obviously this is a continuing conversation we've been having between Zebra and Denali, really about the impact that not just the inflection points technology can have on direct care, but also indirect care, and what that means to the patient experience and what folks like ourselves, our families, friends of families, et cetera, can experience. I think where we probably want to start today, though, is talking about really what is the potential inflection points of AI have on the way direct care teams are impacted. So we're thinking folks on the floor, folks on the ground, not just the doctors, but most importantly, the nurses, the care practitioners, the PAs, et cetera. What kind of themes are we seeing in the market today?
Yeah, I think a lot of people just don't really understand that what AI is and what it can really do for them. You didn't mention that I still work the floor as a nurse. I've done that. I still do that. I just recently picked up a shift here Christmas Eve to help out a coworker, and with so much changing in the nurse clinician shortage that we have, as well as the aging of our patients, the comorbidities of the patients, the acuity of it. AI is very, very important to help not only reduce the clinician workload, but really help with our critical thinking when a patient is facing some type of crises. So we talk about AI, they've been using AI for many, many years, right? We just don't call it AI, right? We've been using predictive analysis. We've been using early warning systems to let us know that a patient is at risk. And even to help with staffing models. We've been doing that for a long time, but all of that is what AI is. As you see in the direct patient care, I was out visiting a hospital recently, and a nurse walked up to me and she said, I just want to know, I'll be able to take a picture of a chest tube setup and for it to tell me, is this correct? That's huge. I mean, you think about that's huge for somebody who may be a new nurse who is actually doing their first chest tube, or somebody like me who still work the floor, but I don't work the floor all the time. I'm doing 1 or 2 shifts a month. And so maybe I don't get a chest tube that often. Of course, as a float nurse, guess who's going to be the first person to get a chest tube or a tray? It's going to be me, right? So AI is definitely something that will really help, not only help with that clinician, reducing that clinician workload, helping them think, but also still keeping the patient safe. I mean, that's really our ultimate goal, is to keep that patient safe and to have better outcomes with that. So that's huge. I mean, as we do know, nurse dictation is out there now, and being able to actually dictate or actually just do natural language. Now, I'm not going to say dictate because nurses don't dictate. We talk naturally.
Yeah.
So walking into a room and doing a natural conversation with a patient, and then having AI pick up the key points from that conversation and then allow me to review that documentation is huge. I mean, nurses are not burnt out. We're not burnt out for taking care of patients. We want to take care of patients. That's why we went to school for, but we did not go to school to know how to be on a computer for 14 hours or 4 hours after our shift is ended. That's where the burnout has come from. And also the tasks that are not I mean, they're important for the patient's overall care, but we're not working to our highest level when you think about our license. So I think AI plays a huge part, not only for the clinician as the nurse, but all clinicians, helping them, making sure that we're doing what's best for the patient in the
Well, I
surgical
think
suite.
I was just getting real quick. I think that's a kind of an important call out, because oftentimes when people think about AI and artificial intelligence and the impact it's going to have on various industries, we're obviously talking about healthcare today. But the first thing people often go to is it's going to replace a function. And I think part of what sets us apart in this conversation is Zebra has this long told story around sustainability. And it's not traditional sustainability around green initiatives, it's around how to augment, right? It's about how to augment the roles that people play on the street, on the ground, frontline folks, including nurses. And so I think part of the sustainability model and the impact that AI can have on direct care delivery is it's an augmentation, because there are worker shortages, because there are an increased number of chronic care patients than we had 40 years ago. In some cases, the only way that you can actually deliver that care and improve patient experience at the same time, or outcomes, is by introducing some form of technology to help people work more efficiently and still provide that quality of life balance too. Because I think that's, you mentioned you went to school, your peers went to school to be able to help people, right? To deliver care. You don't get to do that though if you are doing 2 18-hour shifts in a row, right? So there is going to be a compromise at some point. So there needs to be help. And a lot of that time today is spent on overcoming some of the technology hurdles that have been introduced that are helping. But I think that's one area where AI is often overlooked as an augmentation tool to assist. And you and I talked about this before. Maybe AI doesn't mean artificial intelligence, it's assisted intelligence.
You hit it right on the head. Because it's not just about the shortage of nursing or shortage of clinician. It's really helping to augment the areas that we are not skilled or trained or don't have that experience. You know, where I worked back in the day, we had, a higher level of advanced level nurses as far as BSNs or compared to newer nurses. And now when you go to hospitals, you just don't see that because
Yeah.
clinicians have left the bedside. And so the mix is not there anymore. So that's where AI really helps, even from the educational standpoint. I mean, when you're talking about training, but even when you're actually in a particular workflow, and if I'm doing a workflow incorrectly, AI can say, "Hey, that's not right. I see you're trying to do this. Let me help guide you." Like that's huge. That really saves time, and again helps reduce error when it talks about taking care of the clinician. So, and again, not just in healthcare; it's in all venues.
Yeah.
Um,
Yep.
when you think about remote patient monitoring, I mean, like, we're using people, like, of course, it used to be 12 people or however many sitters you had to have for that day, and they've gotten that down, and we're watching patients on the camera. But even thinking about that, you really could change and use, you know, AI to actually do that monitoring. Of course, you'll have to have the right devices to do that, where you can send those alerts to the nurse. And I mean, that's the role that our devices play today, is
Mm-hmm.
being able to sit, on the hip of the nurse or the clinician to receive any types of alerts, to let them know that the patient is, at risk or getting up or whatever's going on. But AI is, again, like you said, it's not just artificial intelligence, it's assistant, it's augmenting, it's really helping with those workflows. And again, for somebody who is new, maybe not as confident in themselves in doing whatever they could do, that's where AI, really steps in and helps them, and to really help, reiterate what they're thinking, or if they are not on the right track, helping them make sure they're on the right track to take care of the patient. So yeah, not only just that, not only inside the hospital, also outside the hospital, AI is, you know, something that can be used for home health care, in that space in the same concepts. I mean, we know what we're dealing with when we go into home healthcare, right? Not
Yep.
only documentation, most of those places is paper-based, but um, if you have a device that can help with dictation or recording of that natural language processing, of course, and then taking that information and putting that back into the electronic chart is huge. Helps
Yep.
with that as well. Not
So,
even including safety.
well, so there were two topics actually. I was ready to kind of take us to. One was around remote patient monitoring and home health, because like you called out, I think that's also another area that's been that patient population has increased in home health, and the available expertise in that space has kind of remained the same, if not declined slightly in the last decade. So one of my questions was around, where do you think AI could actually impact kind of that assisted triage, right? We kind of talked about it on intake when someone's going into the four walls, but a lot of the burden that's placed on healthcare systems today, it's not on people that need to be in the hospital right then and there. It's the people that come in that maybe they could have been better served or assisted or cared for, not having to come in. And that's where home health is extremely impactful. Are there areas where you think that AI could have a tremendous impact on home health?
Yeah, I mean, my mind goes like off the chart when thinking about the possibilities of what AI can really do in the home space, and not just for actually the provider that's going into the home, but also the
Hmm.
family, the caregivers that are there. I think about my own grandmother who suffers from a heart failure, and I don't live anywhere near her, but she was in the hospital last year a number of times and too many times for me, like within 30 days, she was in the hospital. And as I was talking to my family members, I was asking them certain questions and I was, getting pretty frustrated with them. But again, I'm a clinician, they're not a
Hmm.
clinician. So where does AI come with that? I think AI in a home health space comes with things like that. Like for her case, telling her, okay, you picked up 2 pounds, you've picked up 3 pounds, or if she's monitoring oxygen, they can say this has happened to you. You should call the doctor. What you see out in when it comes to a non clinician, they wait till the symptoms have come severe. They've gotten severe and then they
Guilty.
call
Yep.
the
Yep.
doctor, right? And like who
That's
wants
right.
to not be able to breathe and then call the doctor? Like early,
Yep.
we need early signs. And so that even also helps with the patient outcomes. So I think there's so many possibilities with AI because as you know, we don't have room for patients or we don't have enough clinicians to take care of patients. So, and with the COVID crisis, we saw with COVID that um, we didn't have beds and people were at home. And even now, more people are going home sooner than they would probably want to, or they're not coming into the hospital. So AI plays a huge role in home health. They have to be equipped with the devices and with AI that's going to help them with their workload because we're putting more on home health, but we haven't changed the dynamics. We haven't
We
changed
have not.
the technology, to support them.
That's right. Well, and even there, I think about we're talking about how obviously AI can impact direct care, meaning people that touch touch patients directly, are licensed to, et cetera, and provide not just care, but diagnoses, et cetera, and triage. But the other side of that of the equation is kind of an indirect care piece, right? And in that indirect care bucket, there's the ancillary things that people often don't think about, and that could be scheduling assistance. That even could be, as we're talking about introducing technology into a patient's home or to a home health nurse or provider that maybe is not tech savvy. AI could also assist in some of those realms as well, right? There's AI tools out there today that help with not just provisioning of devices and equipment, but I think about how do we decrease the number of things that a patient needs to think about for that remote patient monitoring experience and create a hub, right? Using a tablet, using a mobile device of some kind, but then introducing an AI assistant to help them with troubleshooting, to help them with setting up the devices if something does not set up correctly before triaging by having to physically send someone to someone's home or make them come in to swap out a device. So there's so many different ways, but that's more on the tech side What about on the patient experience side? Where do we see AI having an impact? We talked about scheduling before. Is that a big pillar that you think where it could have an impact around not just scheduling, but reminders, medication reminders, things of that nature?
Absolutely with the medication reminders, but also appointment reminders. When you think about when you're looking at a chronic illness, a patient who has a chronic illness, there's so many types of appointments they need to make sure they're doing. Like if you think about a person who's diabetic, they want them to get a foot exam every year. They want them to get an eye exam, all those types of things. But of course, the person who has diabetes, they're just thinking, okay, I just need to take care of my diabetes. I need to make sure I'm going to my doctor with my, looking at my A1C, my blood glucose, those type of
Hmm.
things. And then it's once they go into the primary care physician, and we already know how overwhelmed even the primary care physician, they have a shortage, right? Where or taking months to get in for an appointment, or if you miss appointment, then it's months before you can get back in. And so I think AI, even from that perspective, with appointment reminders, are huge for that indirect care from the clinicians as well. I want to step back, Marcos, because we did not talk about hospital at the home. We talked about
Yeah.
home health, but
Yep.
hospital at home is huge right now. There's hospitals already, even though regulatory hasn't caught up with it, that they are discharging patients at home to the home, leaving them inside their virtual walls, but discharging them home and sending out nurses to provide care to
Yep.
them, as well as giving devices not only to the nurses but to the family and the patient. And so, where does AI come in that? Now, how can it help? Huge. Again, for the same reasons. The nurses are not there the entire time with the actual patients, but they are there 2 times a day or once a day. And so using AI to help with the acuity of the patient, monitoring the patient in other realms, like using machine vision to monitor the patient to let us know, let the hospital know if the patient is deteriorating, and really helping that caregiver, building confidence even with that caregiver to take care of their family member. Because as we know, I don't know who's going to take care of us when we get sick because of all of the shortages right now. So not
Yeah.
only about the shortage, but also supporting the skill set and the critical thinking.
Well, and that's where I think part of this story is, it's not necessarily a topic for today, but there's a connectivity conversation that needs to happen, right? Where when you do introduce, coming from my background, when you do as a technologist in healthcare, when you do introduce technology into a patient's home, it'll work on day one. You can't guarantee it's going to work on day 30. And the reason being is because connectivity, or there's so many various factors that contribute to that. So it really is around kind of creating this focused ecosystem of technology, applications, and tools, lowering the barriers or the skill barriers needed around the technology for the patient to be able to just leverage it every day. So they're focused on care, not on why is the scale not reading my weight, right? So I think but the connectivity piece of that is critical, and I think we're going to see a stronger push for like cellular first connectivity in that space. So even when I look at what Zebra's been doing over the last couple of years, for instance, of introducing not just kind of LTE, but really 5G and future connectivity standards into your devices, it's a critical path. And the reality is not everyone's doing that in the purpose-built world, right?
Yeah, absolutely. I was thinking as you were talking, I was thinking about that, the work that we do with 5G and also how our devices are 6G ready. And you're
Hmm.
right, a lot of device companies are not doing that. And we are ready because not even just when you talk about connectivity and, in the city, we're talking about, rural areas. And again, I go back to when I think about home health, I go back to the safety of the clinician in the home health space, and being able to get help if they need it, right? And knowing where they are based on GPS locationing. And if you don't have connectivity, right, then that's a problem, right? So absolutely, the work that we have done and we are doing on that is huge. And so connectivity does play a huge part. But you said some key things there, Marco, when you talked about what if what if the device is not working? Like, what if I'm having problem? How can we help? How can technology help? Again, you said it, AI would absolutely have to be there and to help support the clinician, I mean, Google does it. You know, if you think about it,
Yeah,
Google does
that's
it
right.
whenever they set up Google Fiber. That's how they do it. I mean, they don't send anybody out unless they have to, right? They do
That's right.
everything they can before they actually send a clinician out to actually help you. So yeah, it's the same concept.
It may not be zero touch, but it's minimal touch. It's less
Yeah,
touches than it used to be, for sure.
absolutely,
Yep.
absolutely. Um, and as we again, I hate to keep bringing up COVID, but one thing that COVID did teach us is that we don't have to be inside the four walls of a
Yeah.
hospital to receive care, to get care, or we in that situation we wanted to be in front of inside the four walls, but we weren't able to do that, and so care had to take place at home. And I think now with AI, I think we're even better equipped now if we have another crisis like COVID with, patient monitoring, but also just the ability to camera, see, telemedicine, everything that's there. And we haven't talked about the social determinants of health. I think AI really will help in that because we have situations where people can't get to the hospital or they are sick and they're trying to make the best decision to help them. And I think AI can help play parts to really make them understand. Like, if you have an abscess, let's take that for a tooth abscess, and if a patient has money for the pain pill or the antibiotic, which one you think they're going to do? The pain pill.
The pain pill.
Yes,
Yep.
and knowing, but the antibiotic is what they really need to cure and
To cure.
to help
Yep.
that abscess to do further damage, even death to their bodies. And so I just really not, again, AI, not only for education for ourselves, but also just for the patients and the people that are not inside the four walls of a hospital.
I think the piece that that's critical to that is, and this is what I struggled with earlier on in my career, right? Is we're trying to introduce various technologies to impact that care continuum outside of the four walls. Is what does that patient adoption story look like? And while time doesn't pause, right? It doesn't stop. I think folks are certainly more tech or less tech adverse than they used to be 20 years ago. But I think that patient adoption curve is what's going to really drive the impact of these technologies that we're talking about, right? And things like AI, be it assisted or artificial. Because without the patients, there's no care, right? Just in the same way as without the care providers, there are no patients. So I think it's critical that the patient adoption story is part of this. We need to make sure that as we're introducing these new concepts and these different things, that we're surrounding patients as we are with the care providers with the stories of how this is going to help and change, and they're genuine, right? It's not about like this is going to help us help you. No, it really is. It's to help you. So I think that's also, one lesson learned that we probably had from the last 25, 30 years of introducing really different technologies that are patient facing as opposed to just care provider facing, is what does that patient adoption story look like? How do we introduce the technology? And some may call it marketing or advertising the technology, and maybe it is, but it's a critical path, right? It's a critical step to get people excited about how their lives will change for the good by bringing some of these concepts forward, right? And again, removing some of the misconceptions around assisted intelligence or artificial intelligence.
Yeah, you made a very, very good point there. Because we do it, I think we as a society do it a lot. We come up with technology or products and we are giving the patients what we think they want, but we
Mm-hmm.
haven't asked them what they really want or what would be beneficial or how does this really impact you and how can we help you adopt. So really about patient engagement. Um, and I can't believe that not that I've lost touch of that. I remember doing when I worked on my first master's and I had to look at patient-centered care and I had to look at my organization. And I really thought the organization I worked for, really, we did a lot of patient-centered care. But when I started looking at the categories and criteria, is that you should really have the patients involved in every level of your design, every level of your aspect, every level. I mean, and so we do need to do a better job as a society of actually talking to the customer first, right? And who is the customer? It's the patient, whether it's
It's the
the patient
patient.
inside the hospital,
Yeah.
at home, uh, internal customer, external customers, and all the customers along the way. And so, thank you for that, because that's really huge. That we really do need to work with them to make sure that, again, how would this benefit? Because a patient adoption is what's going to it's going to change the game. That's what is important, because if you have technology, if you implement technology, but if there's not patient adoption or engagement, then the patient is not going to benefit.
Yeah. Well, I think that's part of a solution, not just a product life cycle, right, but also a solution life cycle. We call products products, but it's slightly in a different respect than, say, a healthcare system, right? The products they provide, it may encompass the solutions that we've created, right, or designed and or helped assist design. Um, but they have their own kind of product management life cycle that they go through as well. And part of that, if it doesn't exist today, should include some form of patient feedback, focus groups, et cetera. Even if it's small little studies that are funded by non-committing grants, right, to help them figure out, is this technology going to have the impact we believe before we go make some tremendous investment? Are we thinking of this the right way? Are patients going to receive this the way we expect them to? Because, well, patients may have the same ailments that they're trying to get cured from or improve their outcomes around. The reality is every region is different, every situation is different, and so it's kind of that 80-20 rule. But that means that the 80-20, the 80% part that we're trying to solve for, there's a lot that we have to try to fit into supporting, and that patient adoption strategy is so critical. But it's both, right? It's the care teams, they have to buy in, but I think that it will largely be driven by that patient adoption curve. But like you called out, the pandemic changed a lot of that, right? What folks are willing to do to get what they need to get better.
Yeah, and I think because of the pandemic, I think patients everybody are more open to do things, because you could have told us, 6 years ago that we want you to, I'm gonna call you, or I'm gonna, ring you in and talk to you on the phone about your care. And you're like, what? That kind of stuff. But now, we're all for it. I mean, as you know,
Yeah.
most people don't even want to go in the office anymore, right? Most people, I mean, every day they're like, I need a job where I could just stay home, right? Because we stayed
Yeah.
home for so many years, right? When I think about AI and any technology, we haven't talked about this. Even with AI, we talk about technology, but you have to have the right devices. You have to have the right devices to implement anything, right tools, right infrastructure, right. It has to be a whole model to make sure that and we talked about that. So we talking about the patient. So it has to be the right mix to actually make sure that AI is going to work successfully. And people have concerns. They have so many different concerns. Of course, we'll talk again. People are concerned about, security, right?
Yeah.
HIPAA
Yes.
security. They're
Very
concerned
much.
about that, right? So also we haven't, talked about this, but again, we'll talk about that. But the cost, how much does AI cost? Technology, people say I can't afford it. And I'm gonna say you can afford not to do it, right?
Yeah.
Because of the benefit, if you think about implementing something, and if it's gonna help alleviate these many hours, you can easily prove the ROI, easily. So, but people look at the big ticket price or the ticket price and
Yeah.
not really
Yeah.
seeing the overall of what it can do. And then again, I talk about this all the time, because being a clinician and you can't put a price on a life being saved, or preventing of a fall, or further disease progression based on lack of care.
Yeah.
You can't put a price on that. So, of course, you can't stop natural progression of a disease, but there's a lot of preventable things that we can do. And if technology can help you do that, I can't see why you can't invest in that or want to invest in that. And so, of course, I work for Zebra, but I've been a fan of Zebra for many years. The hospital I worked at definitely implemented Zebra back in 2016. So I've been a fan of it, and that's why I'm here with them. But it's about having the right tools that can help with connectivity, but also,
Hmm.
uh, the camera that is on, everything that's actually on your devices, you need to take that in consideration whenever you are implementing technology, because not having the right tool can really impact how that technology works.
Well, and I think like you said, we're going to have I think more than one conversation on this topic because there's a few things we didn't really get to, right? Some of it is we've talked about what we've seen and where we, at least in the next short window of time, where things are probably going to go. But I think one of the conversations that would be really interesting to explore is kind of what are those long-term trends of the impact of AI on healthcare can have. But the other one is really around how do we make some of this real, right? Because a lot of when folks think about AI, they think about a server in some data center or in a cloud somewhere. And the reality is that may be where the models live, but it's the things in the facilities, in the home. We've talked about devices, but we really haven't talked about all the other quote unquote sensors that feed data into these models that lead to quicker decisions, right? That lead to that assisted intelligence model. So, obviously there's so many different things to explore, but there's vision as a sensor, right? So you talk about fall prevention, leveraging machine vision for fall prevention has been what, almost 35 years, right? Um, the good news is that hasn't evolved much because it's proven to work. But think of all the other things that vision as a sensor could be used for. It could even be used to address and monitor stocking levels on a floor to then automatically create a ticket to say these supplies, more of these are needed on this floor as opposed to waiting until it's too late. So little things like
Absolutely.
that those are some things, Cassandra, I think for the next part due, right, that I would love to explore with you because there are some unique things that Zebra is doing in that space, that Zebra and Denali are doing in that space together that I think are worth exploring and talking about because that's really where we can make some of this real. A lot of this has been that we've been seeing has been intangible.
Right.
Yeah,
Yeah,
so
I agree, because that's where we need the proof of concept now,
that's right.
right? And also, I would love to see, proof of concept in the healthcare space, because there's so many things that we can do with that, in the healthcare space as well. When you talk about machine vision as well, or vision, as far as, even vital signs and things that we're actually touching the patient. We, if you're not, I mean, I love informatics. I love technology. It's my niche. And
Yeah,
10 years ago, no, I couldn't have said this, but it is. And, the typical floor nurse may not even understand that the world is really open and to really help. And that's where, technology, we're just here as a partner in this healthcare journey, not to take away, not to diminish, but really to support and help them be the best version of themselves, and also work to the highest level of their licenses. And that's on every level of clinician.
love it. Well, Cassandra, I think that's time for today. Again, till next time. I'm really excited. When we first met, we instantly I think clicked based on your clinician and clinical experience with technology, me coming more from a technologist perspective in healthcare, but kind of being born and bred in that. So I'm really excited about where these conversations are going to go. And I would love for this series to continue. So, but appreciate all the time today. Thank you again.
Thank
And
you.
do you have any closing thoughts?
I don't. It's my pleasure. I love to talk about technology and its impact on the clinician, because a lot of clinicians are afraid of technology. And again, um, I love it. As I mentioned that before, and I'm really just here to help, just share and open up the doors about how technology can really impact us in a positive manner. not to take away from us, not to take our jobs or anything like that. It's technology we needed. We have to pivot. We're doing more with less, and technology is what's going to help us continue to be the best providers we can inside the four walls, outside the four walls, at home, on the streets. That's what's going to help us do that and continue to do what we love. I love taking care of people. And I love my nurses. That's why I still sit on both sides. I still go to work on the floor with them to help them to understand what they're still dealing with every day. And then I work on this side to really help change the world for us. So thank you.
Wonderful. Thank you, Kassaundra.